Good afternoon. I am Dr. Vijay Kumar. I am Director Urology, Department of Urology, Max Smart, Saket. I am dealing with the urological diseases of patients, and I have been treating various kind of urological disease, including prostate, cancer prostate, kidney stones, for so many years. I have experience of more than 30 years, and I am attached to Max Hospital for last 15 years. My special interest is in endourology, laparoscopic urology, and lasers in various treatment of urological diseases.
What are the treatment options available for patients with benign prostatic hyperplasia?
Now, first we need to know what is prostate. Prostate is a accessory sexual gland in the man which helps in production of semen so that the sperms can survive in the semen when they are out of our body and they are received by the vagina so that the procreation can happen. Now, this prostate gland is in man is just below the bladder and it encircles urinary passage. So, enlargement of prostate can cause some symptoms in male patients with the advancing age. Now, the common question is who all are at a greater risk of developing BPH, that's benign prostatic enlargement or benign prostatic hypertrophy. Usually, the enlargement of prostate starts around the age of 45 to 50 years and is an age related phenomena. And advancing age can lead to enlargement. And in these patients, the symptoms can appear varying degrees from the mild symptoms to significant symptoms. Family history is important in these patients because some patients can have enlargement of prostate which runs in family, although the cancer is more related to the family tree, but benign enlargement can also be there. The other associated factors which can increase the risk of enlargement are diabetes for long duration, the obesity, and some patients with the cardiac disease. So what we call is that metabolic syndrome can have effect on the enlargement of prostate, especially the overweight patients, uncontrolled diabetes for long years can have enlargement of prostate.
What are the various tests which can help diagnose benign prostatic hyperplasia?
As we say that this is a benign enlargement, it means when it starts increasing in size, it causes some symptoms, and then patient presents to the doctor. When they come to us, then we do certain basic tests like examination of prostate by our finger so that we can assess any abnormality in that, especially the size of the prostate or the hardness or any other abnormality in the prostate. Then some lab tests like urine test, blood test like serum PSA, which is a cancer marker, a screening test for the cancer prostate is done. Then we do kidney function test in blood and the routine ultrasound of kidney, ureter, bladder, and prostate to examine the size of prostate, any residual urine after passing urine, or any change of prostate, or the effect of residual urine on the kidneys. So these are common tests which are done in enlargement of prostate. And usually they suffice, and we are able to make a diagnosis and then suggest them treatment.
Is there any association of benign prostatic hyperplasia and prostate cancer?
There has been no relation of benign enlargement and prostate cancer enlargement, but the patient can have simultaneously both things. It means the patient had enlargement of prostate, they present with the symptoms, we can diagnose that they can have prostate cancer in these patients also. What I mean to say that there is no clear-cut symptoms which can suggest cancer prostate or benign enlargement of prostate. Symptoms presented are same, and we need to examine whether they are benign prostatic enlargement which leads to symptoms or the cancer which is leading to symptoms. As such, there is no relation between benign enlargement and cancer. The common thought that if I have enlargement of prostate, it is going to definitely develop in prostate cancer is not so. And even the patient who has undergone treatment for benign enlargement, can have same incidence of cancer prostate which is in normal population. It means there is no relation between the enlargement in benign and cancerous form. Now, there are various ways of treating these patients. So, what are the common modalities of treatment of these patients? We have two broadly groups for the treatment. One is the medical management of these patients, and another is surgical management. Medical management means the patient's symptoms are mild to moderate, and they are not so severely distressed by these symptoms that they can wait for the treatment effect to come in few days, and then they can continue with the medication. The commonest medications used for prostate are to relax the pressure on the urine passage so that their flow can improve. They have no difficulty in passing urine. They are able to empty their bladder so that their chances of infection in the urine becomes low. So this is one group where the flow improves with the medication. The second group of medication is where we give medicine to shrink the size of prostate so that in long term they can avoid any intervention in the form of surgery. Now, there are certain absolute indication for surgery in patients. These are acute retention of urine. It means the urine is completely blocked and the patient requires catheter to empty the bladder, and we have tried the medication and he is not able to pass urine, and then finally we take a call that he may require surgical intervention. The second can be retention of urine, or there is a partial retention, he is partly able to empty it, and then the effect of residual urine is causing damage to the kidneys. Then we have to do the surgical intervention to safeguard the prostatic renal damage, kidney damage. The third group can be the patient who is forming stones in bladder because there is a residual urine, there is retention of urine in bladder, and the stones are forming. And these patients can require surgical intervention. And fourth group is that if they are getting bleeding from the prostate and we have ruled out there is no other cause and recurrent bleeding is bothering the patient and they require the surgical treatment. Otherwise, all the indications are relative. So these four groups are absolute indication where a patient may require surgical intervention. Now, surgery can be in the form of nowadays all the procedures are endoscopic procedure. We need not cut abdomen and remove the prostate. They are all endoscopic, minimally invasive surgery. The commonest surgeries are TURP, that is transurethral resection of prostate, where we use electrical current and remove the prostate. The second category is laser surgery, where laser is used to enucleate the prostate so that the blockage is taken care and there is a minuscule bleeding. These lasers can be in the form of holmium laser, it can be KTP lasers or diode laser. So these two are broadly where procedures which help in removing the bulk of the prostate and make patient comfortable in passing urine. Other procedures which are used for the treatment are on those patients where we cannot do the surgical procedure and they require or they are on blood thinners where surgery is contraindicated, or they have the advanced age and then they are not fit for surgery. Then we do very minimally invasive procedures as OPD. These can be in the form of urolift or RISM, where we can reduce the size of prostate and open the passage of urethra so that they can pass comfortably. In one technique, we use vaporize water so that the tissue gradually becomes dead. And another one, we use staple kind of things so that the passage is opened up by minimal invasion. And this patient can walk away in the evening after the procedure. These are as OPD procedure. But they are not to reduce the size of prostate immediately. It takes time for them to work. So these are the common procedures which are required for the treatment of prostatic enlargement. Thank you.